Is cough that develops and lasts for about 1 to 2 weeks after malaria treatment normal? If you have been coughing after treating malaria with anti-malaria medicine, is it something you need to worry about? Don't worry, this is usually normal and may not have to do with virus or bacteria. Instead, this is why you cough. Malaria causes inflammation in the body, and that irritation can affect the airways. So even when the malaria is gone, the throat and chest might still be sensitive. The cough often starts dry, and later you may bring up clear spotting. This is part of the healing process. If there is no wheezing, no chest tightness, no fever coming back, the spotting is clear, then it is likely you don't need antibiotics. What can help? Drink warm water. Take honey before bed. Do steam inhalation and avoid dust or smoke. Simple expectorant can also help. But please go to the hospital if the cough lasts more than 3 weeks. The spotting turns yellow or green. You have chest pain, difficulty breathing, or cough up blood. So remember, coughing after malaria is often just your lungs clearing out, not a new infection. Stay healthy always because health is wealth.